Do you carry stress in your jaw? Does it ache or click or sometimes lock up even, especially when you're under pressure, holding your teeth together, trying to hold it all together? It's not just tension. It's a protective reflex, and it has an awful lot to do with how you stand and how you move. And importantly, today I want to talk to you about tiny little trigger points inside the jaw muscles that you can learn to release by yourself in a simple, safe way to let those points go and restore ease. But you can't just do it in the jaw, you gotta work with the whole body. Hi, I'm Dr. Melanie Carlone, and welcome back to Why It Hurts and How to Heal. If you're new here, please do a sister a favor. Like this video, subscribe to the channel, and share anything in the comments that you want to know about. Let me know, do you grind your teeth? Are you clenching? Have you had to wear night guards and they just don't seem to work? Do you notice jaw tension when you're stressed? Ask questions because I really love to engage. Maybe I can come up with something that'll be helpful to you. So, your jaw is wired directly into your body's stress response. Think about it. It's the top of a whole chain of movements. It's the top of your spine. So you are designed to be ear over shoulder over hip. And we've talked about that quite a bit. When you get into issues, which we do a lot these days, where we're forward, typing, driving, anything that moves the head forward, this 10-pound bowling ball, 8 to 12 pounds, starts to become an enormous weight, and all the musculature back here not only has to hold to keep that head up, but all the musculature here in the front starts to become shortened and pull, and that has a direct effect on your jaw. So let's talk about that and look at it a little bit more. These tension points, especially when you've had old injury, maybe you've had dental work, always use a dental block when you have dental work, have to keep your mouth open. Emotional stress, you've been told all your life just to keep your mouth shut. You have difficulty finding your voice. Years of holding it together for whatever reason causes these tiny neuromuscular end plates, which are where the nerves come into the muscle fibers, telling them contract to get shorter. Those little tiny neuromuscular end plates inside the jaw muscles can get stuck in a spasm or an on mode. That's what we call trigger points. They're really small, lentil-sized bundles that keep firing even when you think you're at rest. And because the muscles of the jaw are peripheral and tied to the autonomic nervous system in the axial skeleton, they're really kind of stubborn. So old protector responses, for whatever reason, that are trying to hold back, they can live there for decades. So that's why gentle stretching, a lot of TMJ programs, and I used to run a whole series of these in a hospital that I worked at, don't work. If you're just stretching, it maybe isn't going to be enough because the nervous system itself needs a direct reset. That's where your fingers come in. So jaw pain isn't just tight muscles. It's these tiny little trigger points that get stuck in protect mode. On. Okay. Let's walk through a simple and safe way to find and release trigger points. So first of all, position and support. So remember, when that head is poked forward, everything here is pulling, everything back here is working, and the jaw is being pulled out of alignment. So first, get your head back over your shoulders, over your hips. There's a whole series of muscles that you can access on the outside, the masseter muscles that run underneath the cheekbone and down to the bottom of the jaw. And when your mouth needs to close, they contract and pull up. So you're going to come into those muscles, these ones on the side. Always want to put one hand on the opposite side of the jaw to stabilize it, and use your tool or the eraser end of a pencil works really well. The key is a small and very focused point of pressure. So first you place gentle pressure along the muscle just below the cheekbone towards the back near the angle of the jaw, and look for the tender spot that jumps out, and it literally has a jump response when you hit it. You'll hit a lentil-sized point, stabilizing here. I'm pressing pretty darn firmly here, and woo, I can feel it. And I used to have a ton of them. Lots of dental work in this mouth. So on a scale of 1 to 10, or 0 to 10, 0 is nothing, and 10 is, boy, you better quit or I'm gonna jump. Aim for a 6 to 8, so it's pretty tender, but guess what? It will only be for a moment. It'll be tender, but it's safe. It's never sharp or alarming. So you're going to hold that pressure, breathe into the low back ribs, telling your body, this is safe. I can do this. And stay with it until the tenderness begins to melt. And it will take anywhere from 20, sometimes up to 90 seconds, a minute and a half. But as you hold, you'll start to feel it melts. Now, sometimes as one point lets go, another one will reveal itself because they come in clusters, right? Think three-dimensional. They're all throughout the muscle there. Move gently to the next one, but I would suggest no more than like 3 to 4 in a session. You don't need to go crazy on this. So you press and hold, come to a next one, press and hold, usually in a small area. And after it's released and gone down to about a 2, or sometimes away completely, then you're going to slowly draw your hands downward as you let your mouth gently relax. Imagine as you do this, the muscles lengthening, the bones stacking. Breathe into the low back ribs. The whole system begins to soften. Then you can release and go to the other side. The more you do this gently, you'll see that they start to go away. You're giving them the message, I'm here paying attention to you. You're giving them direct pressure to tell them they don't need to hold anymore because there's a whole bunch of reasons why they stay holding. You're letting them know. You breathe into your low back ribs so it's safe. As they release and let go, they stop and then they recognize there's a lengthening process there. The musculature realizes it doesn't need to go back into the spasm mode. Trigger point release isn't about forcing. It's about understanding, supporting, and helping the nervous system to reset so it doesn't have to hold on like that anymore. By releasing these points, you're not just loosening muscle, although you are. You're teaching your nervous system to come out of protect mode, that it's safe now. So there's a lot of benefits to that. First of all, just reducing TMJ pain and clicking and getting your mouth to track straight. Softer jaw muscles, easier chewing. Less clenching at night. You should notice that that really makes a difference. Even headaches and neck tension will improve with this. But also a calmer sort of baseline because the jaw is like a key stress barometer. And as you get in there and begin to work it and soften it, it really makes a difference. But here's the bigger picture. When the jaw muscles let go, and you've had a history of sitting perched forward, the head forward, everything in the back becoming tight, the front pulling, as you begin to become more ear over shoulder over hip and release the tense musculature in that jaw, everything begins to realign. There's more blood flow in the brain. It's easier to stack yourself up. Your ear over your shoulder, over your hip becomes easier as you sit at work. Bone becomes stacked on bone, and that means these muscles don't have to grip so hard to hold your head up. They don't have to work so hard to close your jaw. The alignment of the temporomandibular joint, which is right around the ear, begins to have more ease around it. Trigger points keep you locked in a forward head tension. Release them and feel the effect that alignment has. It starts to feel more effortless again. Think about it in nature. Animals don't hold on to jaw tension after stress. They release it with a shake, a yawn, a stretch, and they're able to let go. They come back to a baseline. But for a whole bunch of reasons and the way that our brains work, we often suppress that release. So when you show self-care, when you're paying attention, you actually soften these tiny points. You give your body permission to follow through with the same natural reset. Your jaw is designed for ease and swinging. It's designed to let go. Sometimes it just needs your help to find the off switch, and you can do that through addressing trigger points. So try this trigger point release next time your jaw feels tight or painful, and actually try it even now. You should not have these tender points in the musculature. Do you notice them? Do you notice some spots more than others? Share in the comments, I'd love to know. And don't forget to like and subscribe for more body-based tools for your healing. I love doing this. Until then, go gently. Your body is always listening. Be well, my friends.